Welcome to PBCJ's live coverage of the lower house. I am Simone Absalom. The session will start with prayers followed by a roll call of those in attendance. This is usually followed by questions and answers to questions, statement by ministers, items under public business and private members' motions. Before we begin, let's try a Parliament trivia. The Jamaican Parliament has its history in the House of Assembly that first met on January 20, 1664 in Spanish Town. Is this true or false? Get the answer at the end of this introduction to the lower house. The answer will also be posted on Facebook. On the agenda today, the sectoral debate continues with presentations by the following members: Dr. Christopher Tufton, Mr. Fitz Jackson, and Ms. Natalie Nita. The sectoral debate is a public debate in the House of Representatives in which cabinet ministers and junior ministers are expected to record their performance and their projections since the previous year, while opposition spokespersons on the various portfolios will seek answers and criticize or support government programs and policies. That's what's on the agenda. It should be noted that elements of the day's agenda can be changed, moved, or replaced. But before we go, here are a few things you should bear in mind if you plan to attend a session at Gordon House. No visitor shall create any act of disorder within the precincts of the House. No visitor shall be admitted to the House without first obtaining an admission card from the office of the clerk. Visitors who remain within the precincts of the House during a suspension of the session are asked to keep silent. No photography, videography, or sketching of the proceedings is allowed, unless so authorized by the presiding officer, and there should be no smoking inside the parliamentary building. It's almost time to go to the main event, but before we do that, let's get the answer to the trivia. We asked, the Jamaican Parliament has its history in the House of Assembly that first met on January 20, 1664 in Spanish Town. Is this true or false? It is indeed true. The Jamaican Parliament has its history in the House of Assembly that first met on January 20, 1664 in Spanish Town, then called St. Diego de la Vega. At that time, Spanish Town was the capital of Jamaica and the seat of government. Now over to the proceedings.
Almighty God, by whom alone kings reign and princes decree justice, and from whom alone cometh all counsel, wisdom, and understanding, we thine unworthy servants here, gathered together in thy name, do most humbly beseech thee to send down thy heavenly wisdom from above, to direct and guide in all our consultations, and grant we, having thy fear always before our eyes, and laying aside all private interests, prejudices, and partial affections, the result of our counsel may be to the glory of thy blessed name, the maintenance of true religion and justice, the safety, honor, and happiness of the Queen, the public weal, peace, and tranquility of the island, and the uniting and knitting together of the hearts of all persons and estate within the same, in true Christian love and charity, one towards another, through Jesus Christ our Lord. Amen.
The Honourable House now resume its sittings. Call of the roll.
Mr. Witter, Mr. Samuda, Mr. Olness, Dr. Clark, Mr. Shaw, Dr. Chang, Mr. Montague, Ms. Grange, Mr. Henry, Mr. Bartlett, Mr. Mackenzie, Mr. Chuck, Mr. Darrell Vaz, Mr. Warmington, Mrs. Robinson, Mr. Hutchinson, Dr. Wheatley, Dr. Tufton, Mrs. Williams, Mrs. Malahoo Fort, Mr. Spencer, Mr. Green, Mr. Terrelong, Mr. Main, Mr. R. Scott, Mr. Azan, Dr. Bloomfield, Mr. Brown, Mr. Burke, Dr. Brown-Burke, Mr. Buchanan, Mr. Bunting, Dr. Campbell, Mr. Campbell, Mr. Clark, Mrs. Cuthbert Flynn, Ms. Daly, Mr. Daly, Mrs. Dalrymple Philibert, Dr. Dunn, Mr. Fagan, Dr. Ferguson, Mr. Golding, Dr. Guy, Ms. Hannah, Mr. Hales, Mrs. Holness, Mr. Hilton, Mr. Jackson, Mr. Kellier, Dr. McNeil, Ms. Nita, Mr. Paulwell, Mr. Phillips, Mr. Phillips, Dr. Phillips, Mr. Pickersgill, Mr. Redman, Mr. Robertson, Mr. Robinson, Mr. Stewart, Reverend Thwaites, Mr. Dwayne Vaz, Mr. Wright.
Statements by ministers.
Mr. Speaker, we'll have a statement from the Minister of Transport and Mining.
Minister Montague.
Thank you very much, Mr. Speaker. Mr. Speaker, the matter of the U.S. sanctions on UC Rizal continues to be a major priority for this government. Allow me to remind this honorable House of the matter at hand. On April 6, the U.S. Department of Treasury's Office of Foreign Assets Control, OFAC, added, amongst others, 7 Russian oligarchs and 12 companies they own or control to its designated nationals list. As a result of being named, all assets of the 7 persons and entities that are within the U.S. jurisdiction have been frozen, and U.S. persons are prohibited from dealings with them. Additionally, non-U.S. persons could face serious secondary sanctions for knowingly facilitating significant transactions for or on behalf of the individuals or entities sanctioned. While the U.S. Treasury Department recently announced a delay in the application of the sanctions, it is yet to provide a full brief on the extent to which UC Rizal has complied. The threat to Windalco's Yuatan operation, therefore, remains. This government remains committed to applying our best efforts to protect the interests of the community and the country. We particularly want to protect the workers, the environment, and the revenues to our economy. We endeavor to save the jobs of approximately 1,200 workers at Windalco and the livelihood of a further 10,000 dependents, contractors, residents, and business persons in communities neighboring the alumina plant and related facilities. The securing of the Red Mud Lake is also a major priority of this government. The following steps are being taken by the government. The Jamaican government will intensify discussions with the U.S. Treasury to secure a waiver for Jamaica under the sanctions. The talks, Mr. Speaker, are progressing favorably, but we cannot offer any guarantees at this time. We will employ our best efforts to ensure that critical supplies, which include fuel, power, and other chemicals, are supplied to the Yuatan plant. Best efforts will also be made to engage and ensure the banking sector support. We have also taken steps to assure the banking sector of any issue or fears based on information we have at hand. We are working with the Jamaica Bauxite Institute and the Ministry of Finance and the Public Service, amongst other stakeholders, to be prepared for any contingencies, as this is a very fluid and dynamic situation. We are well aware of the sensitivity of the matter, and I assure you that this government remains committed to protecting the interests of the Jamaican people. As we continue to monitor this dynamic situation, we will continue to provide updates to the House. We must continue to remain calm and keep all lines of communications open. Mr. Speaker, let me remind all that this crisis is not of our making, but as a government, we are rising to the challenge and we are working for a sustainable solution. In the meantime, no one needs to cry wolf or seek any advantage from this unfortunate situation. Mr. Speaker, thank you.
Mr. Paulwell.
Mr. Speaker, save for that last line. I think it is a timely and appropriate update to this Parliament. And the Minister, last week you would have heard when you completed your section on mining, I asked the question, is that all? Because I really thought that you would want to say a little bit more. And I appreciate the fact that you have shared certain information with me. And as we have said before, that this is a national crisis and we can work to solve it together. And that there was no attempt on my part, really, to take advantage of the situation. I just thought that more could have been done up to that point. But I think in sharing the information with me, as you have done earlier today, I think I can feel comforted and the country can feel comfortable that some steps are indeed being taken to enable the continued operations of the plant, and I await further updates. Thank you very much, Mr. Speaker.
Minister,
thank you, Mr. Speaker. Minister, if you could just, in terms of the section of your statement which said action steps being taken, you said we will employ our best efforts to ensure that critical supplies, which include fuel, power, and other chemicals, are supplied to the Yuatan plant. Are you, by this, do you mean you are encouraging these suppliers to extend further unsecured credit, or is the government in some way going to backstop the exposure of not just these suppliers, but of course the contractors, the employees, etc., all those to whom you express concern?
Minister. Minister, the Hansard people are not hearing you. You need to make sure that
Yes. Mr. Speaker, first I wish to thank the opposition spokesman on mining. We have given a commitment to keep the lines of communication open, and we have kept them open. And he is aware of the sensitive nature and some of the information that we are pursuing and actions. It's a little bit sensitive and would not wish to put them in the public domain at this time. With regards to the question asked by the member from Central Manchester, the information we have is that the plant is sufficiently supplied with fuel and chemicals to keep them going for a couple days well. And therefore, there were some questions asked by some suppliers, including even the banks, and we gave the assurance that the full sanctions come into effect in October. And even since yesterday, the U.S. Treasury has extended the June 5th deadline for selling down of debt and equity to the 5th of August. So persons who would wish to move to purchase shares in N+, which is the parent body, now have until August 5th. There has been an extension. So the situation, Mr. Speaker, is dynamic, and the government continues to work with the company, understanding that this is a private entity, but the government has an interest in protecting the livelihood of the 1,200 workers.
Members, at this time I would like to request that you recognize a number of visitors to the Parliament. Today we have former Member of Parliament, a number of officials and friends, family. Will you welcome them, please? Announcements.
Laid on the table of the House today are the following: Ministry Paper number 56 of 2018, an annual report of the Financial Sector Adjustment Company Limited for the year ending March 31, 2017. Annual report of the Tourism Enhancement Fund. Quarterly report of the Ministry of Health for dated May 2018. And the Ministry of Health highlights of key initiatives for the year 2017-2018. And finally, certified appropriation accounts for head 7200 for the Ministry of Local Government and Community Development for the year 2014-2015, and for head 7200B, Ministry of Labor, of Local Government and Community Development for the year 2015-2016.
Bills brought from the Senate, petitions, papers, reports from committees, notices of motions given orally.
Mr. Speaker,
Yes,
I beg
ma'am.
to give notice that at the next meeting of the House, I will move the following motion. Whereas a public opinion survey conducted by Hope Enterprise in 2006 found 60% of Jamaicans support the legalization of termination of pregnancy under special conditions, such as incest, endangerment of a woman's physical or mental health and/or life. And whereas a 2018 poll conducted by Johnson Survey Research Limited on a woman's right to choose, which was sponsored by the Gleaner, the Ministry of Health, and the National Health Fund, found that 67% of men and 82% of women believe the government has no place in determining if or when a woman ends her pregnancy. And whereas a research conducted in 2014 found that 43% of expectant mothers who were admitted with complications at the Victoria Jubilee Hospital had attempted abortion. And whereas the government of Jamaica has ratified the Convention of the Elimination of All Forms of Discrimination Against Women, the Beijing Declaration and Platform for Action, and the Sustainable Development Goals, which require the government to take the necessary steps to reduce maternal and mortality by addressing the surrounding factors which contribute to it, including unsafe abortions. And whereas Section 72 and 73 of the Offenses Against the Persons Act criminalize abortions and provision of support to any woman who is about to have an abortion, while health facilities across the country, including the Victoria Jubilee Hospital, provide support to women who present with complications from unsafe abortions, effectively and contradictorily being an accessory to a crime after the fact. And whereas all parliamentarians in this honorable House have a moral obligation to ensure women can enjoy their personhood without interference. And whereas the government has an obligation to give women who need to procure an abortion with access to safe and affordable services for the termination of pregnancy. Be it resolved that this honorable House considers the recommendation of the Abortion Policy Group, which was established to provide guidance to allow women the right to choose. Be it further resolved that this honorable House takes steps to repeal Section 72 and 73 of the Offenses Against the Persons Act and substitute it with a civil law titled Termination of Pregnancy Act as a recommendation by the Abortion Policy Review Group in 2007.
Questions and answers to questions.
Mr. Speaker, there are some questions in my name posed to the Prime Minister to be answered today. Can you indicate whether they're going to be answered?
Mr. Seeking.
The PM isn't here, and I've got no information on it, so I cannot respond.
Mr. Speaker, notwithstanding his absence, can an inquiry be made to find out if the questions are going to be answered today?
Mr. Speaker, I beg to give notice that at the expiration of 21 days, I will ask the Minister of Transport and Mining the following 3 questions tabled in my name.
Speaker, as we are on answers to questions, you will recall at the last sitting when the Minister of Energy, Science and Technology made a statement, some questions emanated from that statement, and the undertaking was given that this next sitting this week, the answers will be provided. It would be very helpful, Mr. Speaker, if you could advise us what is the progress with those questions that the Minister promised to provide.
Well, as you see, the Minister is not here. As yet, he has not advised me. I wonder whether the Leader of Government Business can assist.
Mr. Speaker, the Minister is not here, and I don't recall that undertaking was given that will be done this week. What he said will provide answers to the question, but I don't recall it says this week. But he's not here at this time, so I'm unable to elaborate on it.
For clarification, Mr. Speaker, you will recall I had insisted to get some time frame, and you gave the undertaking that you will seek to have it for this week. It's against that background that I saw the update from you.
Mr. Jackson, as I said, he's not here. I was not informed. I cannot question him at this time, but I certainly will do so when he arrives. Motions that may be made at the commencement of public business requiring notice. Motions relating to the sitting of the House. Motions for leave to introduce bills. Presentation of bills without leave of the House first obtained. Public business.
Mr. Speaker, on the public business, we have a resolution, an order, the Honourable Minister of Local Government and Community Development to take the local government municipality Portmore change of name order resolution 2018. Sectoral debate will continue with the Minister of Health, the Member of Parliament for South St. Catherine, the Member of Parliament for North Central St. Catherine. So at this time I invite you to ask you to invite the Minister to deal with this resolution. The Minister of Local Government to deal with this resolution first.
Minister Mackenzie.
Thank you, Mr. Speaker. Mr. Speaker, I rise to start the debate on the motion standing in my name under government business on the order paper, entitled the Local Governance Act, Municipality of Portmore Change of Name, Order Resolution 2018. Mr. Speaker, the House is aware that with the passage of the three strategic laws, which address local government in general and in particular the Local Governance Act 2016, the names of all the local authorities were officially changed from parish councils to municipal corporations. The exception to this designation was Portmore, which already, Mr. Speaker, existed as a municipality under the now repealed Municipalities Act, and was therefore continued as a city municipality under Section 5, subsection 3A of the Local Governance Act, Section 5, and also contain the official name of the municipality of Portmore. The official name, Mr. Speaker, has presented the local authorities with practical challenges that makes its representation to local and overseas partners and other people within the area very difficult, Mr. Speaker. The name provides no distinction in the public mind between the physical space that contains the municipality and the executive local authority. This has created difficulty for both the administration and the employees and the elected representatives as they try to communicate with stakeholders, to do business and to provide service and market the local authorities as an organ of development and change based on the 3 bits of legislation that was passed by this Honorable House under the previous administration. Following consultations, Mr. Speaker, between senior representatives of the municipality, the ministry, the Portmore municipality, at its meeting on June 14, 2017, decided to pursue Section 5 of the Local Governance Act to seek a name change from the municipality of Portmore to the Portmore City Municipality. This was followed by a formal request which was received by the ministry and approved by me as minister. The ministerial order has been subsequently created, Mr. Speaker, dated February 9th, 2018, is the Local Governance Municipality of Portmore Change of Name Order 2018. It draws its legal authority from Section 535 of the Local Governance Act and declares that the municipality of Portmore is to be now known as the Portmore City Municipality. Mr. Speaker, I seek the indulgence and the support of this Honorable House to bring this resolution and approve same, Mr. Speaker.
Mr. Jackson.
Mr. Speaker, I offer no objection whatsoever to the name change. It's a further evolution of the Portmore community and the municipality. And as the minister said, the Portmore remain the same, and the space, so is the Member of Parliament for Portmore too, my fellow MP from Southeast St. Catherine. But Mr. Speaker, it's really an evolution, and as we go through this exercise, I want to put in the records, the memories of some of the stalwarts from Portmore who fought and struggled to create the municipality back in 2003. Persons like the late Mayor George Lee, Big George, and some stalwarts in Portmore who fought not for the mere symbolism of the name, but to create an authority that can be responsive to the needs of the residents of Portmore. You see, Mr. Speaker, we found ourselves in an awkward situation in Portmore, where we were administered from Spanish Town. And for many other communities throughout St. Catherine, they saw Portmore as being not in need of much because of the level of physical development. But if you know the residents of Portmore well, they don't settle for mediocrity. And they're always pressing for the place to be better, and therefore wanted a local authority that could assume that responsibility and see to the development. Mr. Speaker, Portmore is tremendously better for the creation of the municipality back in 2003. And I look forward to its further development. I assure you the leadership that it has and the leadership that it will continue to have will ensure that Portmore becomes the envy of other local authorities throughout Jamaica. Mr. Speaker, I support the motion before us.
Mr. Faker.
Mr. Speaker, my only disappointment in the statement of the minister is that he said that there were a number of consultations. I can't recall being invited to any such consultation. Mr. Speaker, Mr. Speaker, my colleague, Member of Parliament, spoke to those persons in civil society who would have contributed significantly to the development and the evolution moving towards the municipality. I want for him not to leave out our own involvement. Persons like Dr. Paul Robertson, former Member of Parliament, himself, who has served and contributed significantly, and of course, somebody like Colin Fagan, who would have served coming from the community level to the point where it has reached this point. Now, Mr. Speaker, one of the things that wherever is part of this whole business of reform and the reform process, we're always making adjustments and talking about what is next. And our government is speaking about another municipality, another town. Not too long from now, I suppose that will be put forward in this House. Are we now saying that Portmore is a city? I want to understand the distinction between, let's say, a Kingston, or a Spanish town, or a Montego Bay, where you say one is a city as against a town. How do you make the distinction? And is it to say that city municipality is designated to Portmore as a city, or Portmore remains a town? There's also, Mr. Speaker, at one time, when your administration, the administration now was thinking of looking at Portmore as a parish. In fact, Mr. Speaker, while I don't agree with any suggestion that Portmore can become a parish, I want to find out from the minister in his whole program of reform if that is still on the table and there is any consideration for Portmore to become a parish. With that, Mr. Speaker, I want to say that I, like my colleague, I welcome the new designation and looking forward to be working in the municipality and be there for a long time.
Oh.
Mr. Speaker, permission to speak from a seat other than my own.
Go ahead.
No, thank you very much. Mr. Speaker, I rise like my colleagues before me to support the bill that is before us, the Local Governance Act, Municipal of Portmore, Change of Name Order, Resolution 2018. As was said earlier, Portmore, the municipality of Portmore, owes its very existence to exactly what we are looking for from local government, where the individuals, the residents who live there are clear in what it was that they wanted. Well, do I remember that when we came in 2003 to actually establish that municipality, that it was really and truly a creature of the citizens and the residents and their desire for a governance structure that included their voice. And therefore, with the resolution passed in June 2017 for this name change, I do not believe that those of us who sit here would have any difficulty in supporting the wishes of the individuals who have started that process and who have been involved in the governance of the municipality over these many years. I know that there are still some things that are outstanding as far as Portmore is concerned. We did the analysis of the experiment of the separation of Portmore and St. Catherine. We have looked at that. I don't believe that outside of Portmore there have been enough discussions in terms of the lessons to be learned from that to guide us when we get to other towns and other areas who would want to follow the path of Portmore. I believe that it is a case study that is worthy of more debate and closer analysis so that we can learn from the lessons of Portmore. But certainly as it relates to the act that is before us, I would have no difficulty supporting it and to say it is always a good day when the voice of the citizens are reflected in the bills that come before us and that we have the honor and privilege of supporting. Thank you.
Mr. Golden.
Mr. Speaker, I just wanted to make a very brief contribution on this matter. Just to clarify that under the Local Governance Act, and this is for the benefit of members, as I know the Minister is familiar with this, there are 3 categories of entity that are contemplated. One is the municipal corporation, what was formerly the parish council. Then there's a city municipality, and then there's a town municipality, which is the smallest of the 3. In Section 5, the transitional provision deemed the municipality of Portmore to be a city municipality for the purposes of this act, but continued the name Municipality of Portmore unless the Minister by order determined otherwise. And that order has to be approved both by this House and the Senate. So the name that you're confirming today, Minister, is in fact consistent with the legal nature of what it is under the Act now, because it already is a city municipality and you're simply attaching the designation Portmore in front of it. And I think that is a logical outcome. I just wanted to clarify that.
Mr. Speaker, just want to thank my neighbor and my colleague on the other side, and just to say, Mr. Speaker, the contributions by the speakers on that side with a slight, be gracious. Okay, Mr. Speaker. Well, Mr. Speaker, just to say that this is not a controversial matter. This is a matter that speaks to the continuation of local government reform, which is an ongoing process. And so while we get closer to those reforms, but just a word of caution to my friend, the opposition spokesman on national security. I hope when the other bill comes, I will get similar support from you on that other bill, Mr. Speaker. So, Mr. Speaker, with that, I ask that the bill seek the approval of...
That is correct, and that's a draftsman. That is correct.
The question is that the motion number 8 on the order of business be approved. Those in favor? Those against? As I have it. Motion approved.
Mr. Speaker, I now ask you to invite the Minister of Health to make his contribution to the 2018 sectoral debate.
Dr. Tufton.
Mr. Speaker, let me begin this presentation by thanking the Honorable Prime Minister for his confidence in me, in appointing me to this position, two plus years on. To my cabinet colleagues, Mr. Speaker, for their support, my colleagues on both sides of the House for their input in my stewardship. Mr. Speaker, I want to just recognize also the members of the Ministry of Health, the Permanent Secretary and the Chief Medical Officer who provide leadership, the leaders of the respective units, the regional health authorities, the 12,000 plus strong members of the ministry who every day toil to ensure that public health interest is represented. I want to also recognize, Mr. Speaker, a number of bilateral and multilateral agencies who have been critical to the ministry's performance. Many are here this afternoon. I want to recognize all of them. The NGOs who are very critical as part of the partnerships, Mr. Speaker. I want to also recognize my West Central St. Catherine constituency family who are represented here today. Councillors and workers and supporters from West Central St. Catherine who are in the gallery. And last but by no means least, Mr. Speaker, I want to recognize my family, my wife, and at least one of three who are present. Mr. Speaker, Mr. Speaker, as I did last year, given the limitations of time, I have tabled two documents, Vitals, which provides critical statistics on the performance of the health portfolio under the period of review, and highlights of key initiatives. And I commend to my colleagues, Mr. Speaker, for a more elaborate explanation of what has been taking place that they refer to that document. The two documents combined, Mr. Speaker, as well as my own contribution today, will provide a perspective on the performance of the ministry, the challenges, the opportunities, the achievements, as we seek to improve public health. Mr. Speaker, allow me, however, to highlight a few of what is elaborated more on in these documents that have been tabled. And I capture highlighting these achievements, Mr. Speaker, while saying that I think in public health and as a country, we have seen challenges, but there's reason to be thankful, and there's reason to hope for even better days, Mr. Speaker. Mr. Speaker, we launched the Reduced Waiting Time initiative just over a year ago, and the intention there was to limit the time that patients waited in the accident and emergency wards of hospitals by shifting, through improved customer service and triage, persons who are non-emergency cases to the nearest health center. We took 8 health centers and the corresponding hospitals, and that process over the last year, Mr. Speaker, has seen some positive results. We have seen some 60,000 additional visits during the extended hours of those health centers, extended for up to 4 additional hours, and up to 66% of patients within those corresponding hospitals waiting an hour or less, Mr. Speaker, to see a doctor. We will, during the course of this year, Mr. Speaker, given the success of this Reduced Waiting Time initiative, expand on that program. The Compassionate Care Program, which we launched, Mr. Speaker, on November 2018, March 2018, focused on improved customer service. You may recall that one of the concerns we had, Mr. Speaker, was to administer clinical care with compassion. And over the past months, we have trained over 60 frontline staff members, nurses included, at Victoria Jubilee and the KPH, and established that program, enhanced the aesthetics of the environment, improved facilities like bathroom facilities, and the feedback, Mr. Speaker, has been quite positive. During the course of this year, we intend to roll out to another 12 major
clinics within the hospital system this compassionate care and volunteerism policy. Mr. Speaker, the National Cancer Treatment Center launched November 2017 at the Cornwall Regional Hospital, providing high-tech treatment using the high-tech linear accelerator, a modern piece of equipment which was supported by a number of stakeholders led by the National Health Fund, has seen some 1,409 procedures, treatment with radiotherapy, since it has been established, Mr. Speaker. And within another month or two, we will have the other piece of equipment at the St. Joseph's Hospital, which essentially will ensure that public health has the most modern piece of cancer treatment equipment. Mr. Speaker, we are making progress, and we can be hopeful that things will get better. Mr. Speaker, the cardiac unit at the Bustamante Hospital for Children, another legacy issue, but a lot of starts and stops. I'm happy to announce, Mr. Speaker, that the operating theater has now been opened, and we have, in fact, Mr. Speaker, saved some 31 pediatric young lives since the opening of this. Within another month or two, the cath lab will be completed, Mr. Speaker. Again, a very valuable piece of infrastructure to support pediatric cardiac care. The China-aided Western Children's Hospital project, Mr. Speaker, a project that has been in the making for probably 5-6 years, starts and stops. Mr. Speaker, we took it, we advanced it, and I'm happy to announce that an implementation agreement has been signed, and we expect to break ground for the 220-bed facility, 16,000 square meters, providing pediatric and adolescent medicine and surgery, which in a manner, Mr. Speaker, that has never been seen in this country. And indeed, from the perspective of a specialist adolescent hospital, it will be the first, not just in Jamaica, but in the Caribbean. Mr. Speaker, we have reason to be hopeful. Mr. Speaker, our Doctor Clinic program, which we launched, where we took 100 primary healthcare facilities, profiled their needs, and launched to the community, both locally and in the diaspora, both NGO and business community, for adoptions to take place, essentially to help to look after these primary healthcare facilities, has seen significant success. We have seen over 50 expressions of interest. We have already launched at least 4, and Mr. Speaker, it is an excellent example of partnership between NGO and the private sector and the government in the interest of restoring credibility to primary healthcare facilities, which is what the intention is. Mr. Speaker, one thing we're particularly proud of in public health over the past year, and that is the expansion of nurses training, and in particular critical care nurses training, advanced training. You may recall, Mr. Speaker, that I reported to this House a year ago that our nurses are internationally demanded, in short supply, and we were restricted by the lack of capacity, clinical capacity in particular, to train more here in Jamaica. In other words, we could train them in the theory, but we did not have enough hospital beds to train. We took this challenge of international recruitment and limited capacity to the international community. Indeed, I spoke to it a year ago at the WHO in Switzerland, Mr. Speaker, calling for countries to establish bilateral arrangement in advancing critical care training. I am happy to announce, Mr. Speaker, that a year on, we have signed not 1, but 2 bilateral agreements with our partners, China and the United Kingdom, where our Jamaican nurses will train for a part of their advanced training here in Jamaica, and then go to Chinese and UK hospitals with their local tutors to complete their clinical rotation, Mr. Speaker. A significant achievement that has never occurred before. Mr. Speaker, the first batch of nurses will leave for China next month with their tutors, and we will begin the UK program in October, with the first group leaving to Leeds Teaching Hospital next April. In the first year, Mr. Speaker, we will increase critical care nurses training by 100% as a result of this new program, Mr. Speaker. It is something to celebrate. And indeed, Indeed, Mr. Speaker, the world is looking on this. In fact, we have been told by our partners that this may be a prototype for future training because one country cannot do it alone, and there is a shortage of medical trained personnel globally, not just in Jamaica. I want to thank the Chinese government and the UK government, Mr. Speaker. It took a lot of negotiations. It took a lot of adjustment to the curriculum. The nurses and their association who have bought into this program, and I think Jamaica will be better off for it, and the profession will be better off for it, Mr. Speaker. Mr. Speaker, in terms of public-private partnerships, we again established, in the interest of reduced waiting time, private pharmacies to distribute public drugs. You may recall that we launched a pilot project with 17 pharmacies. Over the past year, over 70,000 prescriptions have been written through those drug serve windows located in private pharmacies. Mr. Speaker, we are rolling out an expanded program. We have identified another 35 pharmacies, making the total to be 52, along with the drug serve windows at the hospitals and a few clinics. We will have a network of outlets, Mr. Speaker, to distribute drugs. Thanks to the NHF and the team that have worked on this, no more will patients have to wait for medication. If they can't get it at the hospital, they could go to a private pharmacy to get those drugs, Mr. Speaker. Mr. Speaker, another significant achievement that we think will assist public health is the establishment last year of the Mosquito Control and Research Unit, a partnership, Mr. Speaker, between the University of the West Indies, our own internal vector control unit, supported by our bilateral partner, in this case, the USAID, who gave us some 40 million Jamaican dollars to support. And what this entity, which is located at several locations, but the research component based at the University of the West Indies, will do is engage in research, various forms of research, on that deadly vector, the mosquito. Mr. Speaker, you will recall the CHIKV and the ZIKV experience, which literally brought the country to a halt as it relates to production and to productivity. Well, Mr. Speaker, this Mosquito Research and Control Unit is now actively engaged in research methodologies like sterilization, in actively breeding mosquitoes to study them, testing chemicals, looking at new and improved ways to confront this vector, and also mapping the country to identify the most vulnerable areas. Again, Mr. Speaker, this is a significant development that I believe will help not just Jamaica in confronting this vector, but indeed, working with CARFA, the regional research entity, we believe that the benefits here will extend to the rest of the region. Mr. Speaker, last year, we had some 1.246 million visits to our hospitals, 1.724, and I'm rounding the numbers, visits to our health centers or clinic. And of the hospital visits, Mr. Speaker, some 620,000 were to accident and emergency, a 7% decline in A&E visits, while a 10% increase in health center visits when compared to 2016. We believe that this desirable change, Mr. Speaker, was largely due to the reduced waiting time initiative. In other words, it is desirable that more people are actually going to the health centers rather than to the hospitals, and in particular to the accident and emergency hospitals. Mr. Speaker, we had 187,000 admissions for hospital care, did 36,000 surgeries, delivered 32,420 babies, conducted just under 470 diagnostic imaging services, and some 6 million lab tests. I want to just use the opportunity and invite this House to thank the 1,300 doctors, some 4,400 nurses and midwives, 184 dental staff, 3,200 paramedical and allied health workers, and over 3,000 administrative staff, a total complement, Mr. Speaker, of some 12,161 staff members in public health who have worked hard to deliver over this period of time. You know, Mr. Speaker, I am not by nature a contentious individual. I certainly don't think so. But I understand, Mr. Speaker, I understand the nature of our politics. And I do appreciate, Mr. Speaker, that sometimes there are some who are tempted to court contention in order to achieve recognition.
Absolutely.
I want to touch a little, Mr. Speaker, on the Cornwall regional experience. Mr. Speaker, there is no doubt that perhaps the most contentious issue that has been discussed within public health to date during this year has been the Cornwall regional experience. And I would like to engage us, Mr. Speaker, in some sober truth about this particular issue in making a larger point around the nature of our health infrastructure and the direction in which we need to move. Mr. Speaker, by way of a quick update, because we have discussed this a lot, Cornwall Regional, as a crisis situation, has been stabilized. And I really want to thank those who have worked hard. Because, Mr. Speaker, sometimes we don't appreciate that general management and crisis management are two different things. And it is quite difficult and different to stabilize a crisis which that hospital experience represents. In other words, to preserve the services for the over 500,000 persons who depend on that institution on a daily basis. So we have stabilized the process, Mr. Speaker, in that we now are able to cater to the needs of the people, and that has taken a year. We are on our way in terms of the restoration. The project team is working. But you know, Mr. Speaker, the contention which has brought attention and not necessarily constructive solution to the problem is something that I'm concerned about, and we on this side are concerned about it. And so, Mr. Speaker, in order to address the distractions that have occurred from that contentious discussion around Cornwall, we have gone ahead, Mr. Speaker, and introduced an independent body, and I have announced them already, but I'll repeat again, led by Professor Archibald MacDonald, Principal of the University of the West Indies, supported by Professor Kawe, renowned chemist, Errol Alberga, architect and senior partner in Alberga Graham, Jamaica, Earl Richards, former president of the Airports Authority of Jamaica, and Claudette Bryan, president of the St. James Lay Magistrates Association and a major private sector industry player. And this team, Mr. Speaker, in order to settle the situation, to restore some credibility to the process, to address those who doubt the sincerity of the government, we have no issues in saying to this group, which is their mandate, be the interface between the project team and myself as minister. I still maintain responsibility, but also between the project and the public. And that includes the opposition if they so desire, Mr. Speaker. And that, I hope, will allow those who enjoy the contention, which sometimes acts as a distraction, to settle the situation a bit and hopefully provide some level head as we decide to address the problem as we ought to. It is a very important issue. Mr. Speaker, there's another component to the problem that bothers me, and that is the charge or the accusation that we have ignored the health and safety of the workers at Cornwall Regional Hospital. Now, I reject that assertion. I reject it out of hand, Mr. Speaker. At the same time, it does concern me that it is being made, it is being levied, and some persons may be tempted so to believe, which does not help the process or confidence within the process. Therefore, Mr. Speaker, we have gone beyond that. We have appointed a team led again by an independent mind, Dr. Kenneth James, public health consultant and lecturer at the Department of Community Health at UWI, Dr. Orville Heslop, medical microbiologist, Dr. Jacqueline Duncan, expert in internal and occupational medicine, and our own Chief Medical Officer, Dr. Bisesa McKenzie, and National Epidemiologist, Dr. Karen Webster, to conduct an epidemiological examination study, which includes a tracking component over time of all the workers at Cornwall Regional Hospital who are so interested to participate, to determine their health profile and to determine independently the extent to which the environmental Cornwall has had an impact on them. Mr. Speaker, we have nothing to hide, and I want to send the signal very clear that we have not acted in a manner that is injurious to the staff. There are 1,300 or so workers at Cornwall, and that study, Mr. Speaker, initial cost is approximately $50 million. So we are prepared to spend the money to satisfy those involved that this is never an intention to hide anything. We care about the health and safety of the workers, as we do about the citizens of St. James and its environs. Mr. Speaker, the more general point around Cornwall is that the experience is emblematic of the state of our healthcare infrastructure in Jamaica. And I'm talking now some sober truth that we all on both sides need to accept some responsibility for. The healthcare system, Mr. Speaker, is old, the infrastructure that is. It is limping and needs resources for rehabilitation and expansion. We have not built a hospital in Jamaica since 1997, when the Maypen Hospital took up occupancy of a new building after outgrowing the original edifice that was built in 1974. More generally, Mr. Speaker, when you look at healthcare expenditure, Jamaica has fallen behind in its rate of increase in health expenditure relative to selected countries in the region. Jamaica was rated 5th highest in total health expenditure per capita, but is now ranked last among comparative countries, Mr. Speaker, as it's probably difficult to see that on the table on the screen, but it's reflected there in your manuscripts that you have. Similar trends, Mr. Speaker, have been observed with general government health expenditure per capita in Jamaica, which has gone from US $111 in 2000 to $139 in 2014, while the median among comparative countries has gone from 102 in 2000 to 278 US in 2014. So, Mr. Speaker, while our relative ranking in this regard has remained unchanged, we have moved further below the average, indicating that we have not kept up pace with the comparable countries in terms of government allocation to health. And this is not our last year or year before issue. It's something that has a trend over a long period of time. At the global level, Mr. Speaker, median general government health expenditure over total health expenditure increased from 57% in 2000 to 60% in 2014. In contrast, Jamaica has recorded a decline, Mr. Speaker, over that period of time. Mr. Speaker, it is no wonder we have the challenges that we have, and Cornwall Regional is a manifestation of a greater problem. The current organizational structure of public health, Mr. Speaker, places too little effort on maintenance, preventative maintenance of our aging infrastructure, leaving them to fall in disrepair. And I give you an example, Mr. Speaker, of the western region where Cornwall Regional Hospital is located. There are 4 hospitals in the western region, 1 type A type B, and 2 type Cs. There are 79 health centers serving a population of just under 475,000, St. James and its environment. Mr. Speaker, there are only 2 qualified engineers on staff to service 79 health centers and 4 hospitals. Mr. Speaker, we are going to use this opportunity around Cornwall to do a case study, separate and apart from solving the problem, because I think there are lessons to be learned. Beyond restoring Cornwall, which we will, I think there are important lessons to be learned in order not to get back to this position again in the future, and lessons for both sides of the aisle, depending on wherever we are at any point in time. Mr. Speaker, these infrastructure challenges confront us in a context also of a population with a sick health profile. We have a sick health profile. Lifestyle diseases or non-communicable diseases is the cause of death for up to 70% of our population. We are not in a position, Mr. Speaker, unfortunately, to respond as we would like to. Therefore, Mr. Speaker, it is only logical, since we are now on the bridge to provide leadership, that we need a plan, a roadmap for the next 20 to 30 years to address the issues of population growth, infrastructure, equipment, HR, and financing requirements. Since announcing, Mr. Speaker, in the last sectorial, the need for a 10-year strategic plan, which again started before my time, but we have taken it to another level, I'd like to announce to this House that there are 4 pieces of information that we have been able to put together over the last year, which together combined will create that 10, 20, and 30-year strategic plan. First of all, Mr. Speaker, we have completed the review of the regional health authorities. Authorities that were established based on the British system, 4 regions, never comprehensively reviewed, and frankly speaking, Mr. Speaker, there are a lot of issues that have to be addressed in terms of how they are run and to improve the efficiencies in order to administer healthcare better. We have also, Mr. Speaker, completed a study on the health information systems. How do we create a digital platform to manage patient files, use that platform to advance things like telemedicine? That report is completed, Mr. Speaker, and will be part of that strategic plan. Finally, Mr. Speaker, we have also done a roadmap and are completing the studies on a national health insurance scheme in the context of healthcare financing. And that will be completed in another month or 2. The consultants are working. And the 4th is the 5 hospital study assessment that is being done by the UNOPS, covering Spanish Town, St. Anne's Bay, Maypen, Kingston, and Mandeville. These studies, Mr. Speaker, will look in the context of the entire healthcare infrastructure in Jamaica and make a determination as to how we upgrade where do we add beds, where do we add operating theaters, in order to right-size or optimize the infrastructure that is available. Clearly, Mr. Speaker, we are deficient now, and so this will add some value to that process. So, Mr. Speaker, those 4 studies are going to be critical to that 10, 20, and 30-year strategic plan. And we're hoping that by mid-year, we will have the framework of that plan. Now, I am comfortable with saying we have led that process. That plan is going to take some time, maybe 5, 10 years to bring through to its completion. It's going to depend on both of us to work together in order to make that plan a reality. And I'm calling on the opposition spokesperson, let us work together to ensure we can sign off on that plan so that we lessen the contention and therefore the distraction from serving the public health of the Jamaican people. Mr. Speaker, in all of this, Mr. Speaker, it's about how do we guarantee universal access to health care. And, you know, we need to remind ourselves of what universal access is. And I'm prepared to court even controversy in generating a discussion around what that represents. We have been guided by WHO PAHO, Mr. Speaker. And there are 6 basic commitments that we must be prepared to make as it relates to universal access. First of all, no one should be denied care because of inability to pay. Secondly, full exemption should be for the vulnerable, the poor, the elderly, and children. Thirdly, and what may be the point of controversy, but I believe in it, and we believe in it, those who can afford to pay should contribute through a prepayment mechanism such as a national health insurance scheme, which is what we're working on now to develop this system. Primary care should be accessible to all without financial barrier. And the other 2, Mr. Speaker, augmenting services delivery with private and NGO partnerships. Partnerships are fundamental to effective public health administration, and that includes the private sector. I've given examples of some of those partnerships earlier. And multi-sectoral collaboration should be incorporated to address the social determinants of health. Mr. Speaker, the future requires a national discourse on what are reasonable expectations from public health care services. What is clear is that the public health care system cannot be all things to all people, as the requisite supporting infrastructure is just not there to do it. And frankly speaking, sometimes we create that expectation as politicians. In other words, when we say you are entitled to everything, then the natural response when you don't get everything is going to be disappointment. So we need to right-size that expectation And we need to call on all concerned to be a part of that discussion. Mr. Speaker, in all our planning, primary health care and the role of individual personal responsibility is most important. Too many Jamaicans do not make the connections between how they live their daily lives and their personal state of health. We don't exercise, we eat and drink badly, and only go to the doctor or hospital when we feel ill, which oftentimes is too late. This, Mr. Speaker, is an unfortunate feature of our culture, with the consequences being sickness, compromised productivity, and a ballooning health care cost. Let me explain, Mr. Speaker, because one of the things we've tried to do is to get an economic interpretation, and we hope the country will appreciate this, on the cost of neglecting oneself and neglecting public health. In a recent study I requested from the Pan American Health Organization, Mr. Speaker, Jamaica's economy is projected to lose over $77 billion over the next 15 years, 2017 to 2032, in terms of the direct treatment cost and indirect costs, loss of productivity due to cardiovascular disease and diabetes complications alone. Over that same period, Mr. Speaker, if you scale up the measures, the preventative measures in the first instance, some curative measures in the second instance, we are, according to this report, between 2017 and 2032, we could save some 5,700 lives, restore some 67,000 healthy life years, Mr. Speaker. And this, Mr. Speaker, is the study that was done by PAHO and other stakeholder groups. Mr. Speaker, the reality is, as a government, we have a duty to have a dialogue with the country, to explain exactly what our role is as government, but also to get Jamaicans to appreciate what their individual role is towards their own personal health. And I think a responsible government has to make that call, Mr. Speaker. Mr. Speaker, let us be clear. We must get the fundamentals of good health and wellness by firstly taking personal responsibility. We will continue, Mr. Speaker, in that light, public education around lifestyle, healthy lifestyle practices, as well as policy and regulation to encourage healthier lifestyle habits. In support of this, Mr. Speaker, we will expand the Jamaica Moves program to include a health and wellness program, Mr. Speaker. We are going into the workplaces, speaking to employers and helping them to develop health and wellness programs within their entities. We will introduce Jamaica Moves, Mr. Speaker, in collaboration with the Ministry of Education and Youth, the Jamaica Moves program in the high school system, Mr. Speaker. And I'm going to get back to that because obesity levels in the high school is quite high and growing. We will continue the other initiatives that we started over the past year. Last year, we saw some 5,000 Jamaicans getting health checks through the parish stores, 4,000 participating in workout sessions, and through mainstream and social media, we reached a number of persons, 800,000 or so, with a message about taking personal responsibility for your health in the first instance. Mr. Speaker, we had established a food industry task force to look at our consumption habits as a country and how that consumption habit impacts our health status. And that work will continue, Mr. Speaker. Part of the recommendation of the task force is to look at things like nutritional content on food labeling, product reformulation, food marketing, and advocacy and communication. And Mr. Speaker, you would have seen the advocacy with NGOs like the Heart Foundation telling Jamaicans that these are the consequences of your consumption habits. You must be informed so you can make more informed decisions in your own interest in the first instance, Mr. Speaker. We will continue this program, Mr. Speaker, and we intend to get more persons involved, including the school system, because that age cohort is quite important. But while we're doing this, Mr. Speaker, we're not forgetting our commitment to improving our health infrastructure. And indeed, we have done a lot over the past year. And this colleague, opposition spokesperson on health, is performance before PR. And we believe in PR, but we believe we need to put performance first. Mr. Speaker, I'm just going to list a few of the projects that we have completed, Mr. Speaker. Acquisition of trucks and infrastructure improvement at the waste management plant, $50 million last year, completed. Renovation and expansion of the Linstead Public Hospital A&E and Administrative Department, $144 million, completed. Renovation of the Grange Hill Health Center, $23.6 million, completed. Renovation of staff quarters at the Anota Bay Hospital, $18 million, completed. Phase 2 of the Isaac Barnes Center of Excellence, $70 million, completed. Procurement of mental health buses, Mr. Speaker, $14 million, completed. And I could go on. Repair of the roofs of Maypen and Mandeville Hospital, Mr. Speaker, $96 million completed. Mr. Speaker, we don't just talk about these things, contrary to what is being suggested. In our book, Mr. Speaker, performance comes before PR. And we do believe that the people must know what we do because we have to give account to them. So we make no apologies for telling the people that we're doing what we're doing. Mr. Speaker, there are several other projects that are in your document, but in the interest of time, I will not go through those projects, Mr. Speaker, but the work will continue in this new year. Mr. Speaker, I want to mention a program that we're particularly proud of, which is the waiting time reduction. Mr. Speaker, we have seen significant reduction over 2015, 2016, 2017 under the Reduced Waiting Time Initiative. In fact, during this period, Mr. Speaker, because of the extended hours in those 8 health centers, we have seen some 250,000 visits to those facilities, 60,000 of which was during that extended period of time. And of course, as I said earlier, a reduction in the waiting time at the accident and emergency units, Mr. Speaker, up to 66% persons waiting under hour, 89% under 2 hours, only 11% waited for 2 hours or more. We are going to expand this reduced waiting time initiative by improving customer service, expanding the hours in the health centers, and improving the triage process. So, it is said that 40% of patients who go to accident and emergency really don't have an emergency. But clearly, when you're not feeling well, you think it's an emergency. It's always an emergency. If we have the primary health care facility open with the extended hours and the supporting infrastructure and personnel, then what we do is triage them to the next location and therefore have the time to deal with those who require the attention. Mr. Speaker, I want to look at an important area which I mentioned earlier, which is our young people and the challenge of obesity in our school system. The obesity level among our high school age cohort is a major challenge. The 2017 Global School Health Survey, Childhood Obesity, over the past 7 years, suggests that we are under significant threat within that age cohort because obesity levels, Mr. Speaker, between 13 and 15 years increased by 68% and doubled in boys over that 7-year period. And this House needs to take note. Our next generation, our children, are suffering from an obesity epidemic, which is going to lead to significant health effects later on at our expense, but also at their and their families' expense and the future of the country's expense. And we need to do something about it, Mr. Speaker, and do something about it now. Another recent study, Mr. Speaker, indicated that obesity-related non-communicable diseases are the top health concern for Jamaicans. For example, Jamaicans are very concerned about the health effects of sugary drinks on their children and their own health. Mr. Speaker, they have reason to be concerned because Jamaica, when you look at the international data, ranks in the top 10 globally for soft drink consumption in adolescents aged 13 to 15 years. Approximately 70% of Jamaican children consume 1 or more sugar-sweetened beverage per day, and 77% of our adults are as guilty or worse. They are the ones setting the example for our children. This, Mr. Speaker, is a serious problem. Consumption of 1 or more servings of sugar-sweetened beverages per day is associated with a 26% greater risk of developing type 2 diabetes. These are the facts, Mr. Speaker. And let me just say to the manufacturers of sugary drink. We're not beating up on you. There was a time when we were talking about tobacco, and that conversation continues and will continue, as I will explain later on. Alcohol, overconsumption, abuse, problems also. But frankly speaking, the time to talk about the impact of sugary drink on our population is now, and it is our responsibility to start that conversation. We invite, Mr. Speaker, we have dialogue with the manufacturers, and we're inviting them to come and let us talk. And it has started, and many are responding already. A number are voluntarily adjusting their formula, adjusting their drink to reduce sugar, recognizing the concerns of the population. Mr. Speaker, the harmful effects of alcohol and tobacco also remains high, and those will have to be addressed also as part of the preventative approach to health care. Mr. Speaker, as said earlier, the Ministry of Education and the Ministry of Health are finalizing plans for a nutrition policy within the school system. That nutrition policy over the next year is going to guide a policy towards what is served within the school system, starting with Nutrition Products Limited. And we're almost close to that completion. The initiative, Mr. Speaker, intends to provide a framework for young people to eat healthy, nutritious meals, and the policy will need the support of all stakeholders to achieve the success that is required. Mr. Speaker, the school standards will focus not just on sugar, but on reducing the intake of saturated fats, cholesterol, sodium, and sugar, and increasing vegetable and fruit consumption. And I hear the member about local consumption. That's going to be a critical part. That combined with the Jamaica moves in school and the messaging around that, Mr. Speaker, will be a new frontier for public health to get our young people to change their behavior and change their habits, because they are indeed drinking and eating themselves sick, which is not in their best interest. We are their guardians. We must provide guidance for them. We cannot ignore it. So, Mr. Speaker, effective January 2018, and I met with the drink manufacturers last week and indicated that we would have made this announcement, so they are aware. Effective January 2018, giving ample notice, the government will implement a policy to restrict 2019, the government will implement a policy to restrict certain types of sugary drinks in schools. By sugary drinks, we mean beverages that contain sugar or syrup that is added by the manufacturer, Mr. Speaker. It does not include, Mr. Speaker, 100% juice or unsweetened milk. The Ministry of Education, Youth and Information, and the Ministry of Health will work with manufacturers and distributors to provide the policy guidelines on what the requirements are for these drink products to be allowed in schools. Mr. Speaker, we're not stopping there. We take the view in public health that if we are going to impose our influence, and by the way, this is supported by the Prime Minister, by the Cabinet, because we believe this is truly in the interest of our young people. But if we're going to impose it in schools, Mr. Speaker, I believe in public health we must also lead by example. And so the same policy will become effective except for where there are prescribed dietary guidelines for patients. The same policy will be introduced in our public health infrastructure across the length and breadth of this country. So, Mr. Speaker, starting next week, we will meet with the manufacturers. We will explain what these guidelines mean in terms of what is a per serving allowed amount in terms of those drinks that are available. And they will have to conform to those guidelines, reformulate products, use existing products that may be available, use local products, but effective January 2019, sugary drink will be restricted as part of the response to the obesity crisis in our school system. Mr. Speaker, as it relates to Public Health Tobacco Control Regulations 2013, and this is now tobacco and the fight for better health based on a limiting tobacco consumption, first or second hand. We are cognizant, Mr. Speaker, of the fact that greater enforcement is required to allow for compliance And so we will continue to sensitize our critical stakeholders.
Members' time for speaking has expired.
Mr. Speaker, I ask that the minister's time be extended by 15 minutes to allow him to complete his presentation.
The motion is that the minister's time be extended by 15 minutes to allow him to complete his presentation. Those in favor? Those against? Minister Tufton.
Thank you very much, Mr. Speaker. Thank you, colleagues, for... Mr. Speaker, we are going to advance our approach. And I want to use the opportunity because, you know, let me just say this. I told you I wasn't a contentious person by nature. But beyond that, we must recognize achievements wherever those achievements come from. And government is a relay. It's not an event, it's a process. And I want to single out the former Minister of Health, former Minister Ferguson, for championing the cause of anti-tobacco in Jamaica. Indeed, that will be your legacy. That will be your legacy, member. And it is only right that we take the baton and take it forward, not just because we have international obligations, but because it is the right thing to do, Mr. Speaker. So, Mr. Speaker, we are advancing this year the comprehensive legislation on tobacco control. And I just want to give an indication of what this will include, Mr. Speaker. It will include mandatory prohibition on tobacco advertising, promotion, and sponsorship, including a ban on point-of-sale tobacco displays, the prohibition of sale of all forms of tobacco products to and by minors, and the regulation of price and tax measures to effectively contribute to the reduction of tobacco consumption. Mr. Speaker, we have to deal with this issue of non-communicable diseases. It is costing us as a country, and tobacco is a major contributor to that. Mr. Speaker, the same is the case for alcohol, Mr. Speaker. Now, all of us like our little something now and then. And Mr. Speaker, I am not preaching or suggesting that we can't have our little something now and then. Just to be brand indifferent, Mr. Speaker. I don't want to promote any brand or discourage any brand. But, Mr. Speaker, let me just make it clear. Alcohol is the most commonly abused substance in Jamaica among adults and young people, according to the findings of the National Drug Use Prevalence Survey of 2016. The harmful use of alcohol causes according to the scientists, 200 diseases, including breast cancer, liver cancer, cardiovascular diseases, and the associated costs linked to that. Preliminary data show, Mr. Speaker, that scaling up the package of interventions will result in over a 15-year period, an estimated 518 lives saved and some 23,000 healthy life years restored to the population, Mr. Speaker. Mr. Speaker, the current evidence shows that the likelihood, similarly so, and I'm talking about the Road Traffic Act and road traffic injuries, that alcohol's contribution or consumption and contribution to road traffic injuries in Jamaica is significant. This again is according to what the study suggests. Road traffic injuries 5 times higher for people that drink alcohol when driving than it is for those who do not. The more that people drink, the higher the risk, and each drink increases the risk of a road traffic injury by some 13%, Mr. Speaker. In fact, the economic impact of road traffic injuries is significant, with indirect and direct costs due to road traffic injuries in Jamaica are estimated to be about $3.2 billion. This fiscal year, Mr. Speaker, we will be mounting a national public education program on the harmful effects of and use or abuse of alcohol. And through a national dialogue, we will advance a national alcohol policy that will take into account underage drinking, advertising to minors, and will incorporate measures to support the new Road Traffic Act, Mr. Speaker. In other words, Mr. Speaker, we are going to encourage, initially through public education, but ultimately through policy, the responsible consumption of alcohol, because we recognize that it is also contributing to the public health threat and risk that we are experiencing in our country. Mr. Speaker, the other big NCD is mental health. And I want to quickly speak to mental health. Last year, Mr. Speaker, I had done a mental illness and homelessness report, which was completed in 2017. The report suggests that mental illness ranks among the most common NCDs in Jamaica and indeed the world. In fact, I give you a little thing for us to ponder on here in this house. The report suggests that of every 10 persons in Jamaica, at least 40%, will or have experienced some level of mental instability at some point in their lives. And you know, Mr. Speaker, I look around the room and I see 63 of us in here, and if I apply the same formula, I leave it to all of us to decide who are the persons who have been so challenged. But seriously, Mr. Speaker, mental illness affects uptown and downtown, old and young, rural and urban. And the problem with mental illness, which is why it needs to be addressed, the stigma attached to mental illness restricts our willingness or capacity to treat with it. Oftentimes we are not able to identify the signs or the symptoms. And when we do, because of the culture of rejection, we end up treating those who are challenged as outcasts. And that's why there's a close relationship, Mr. Speaker, between the mentally challenged and homelessness. Usually when you see them on the street, it's because they have been abandoned by their families. I go worse than that. Bellevue Hospital today has about 800 inmates, patients. 500 of that 800 patients are persons who effectively could have been sent home and lead normal lives under treatment, but have nowhere to go because they have been rejected by their family. In other words, Bellevue Hospital today is an infirmary. And Mr. Speaker, the report speaks to a range of recommendations which we must take on to address, in the first instance, destigmatization of the mentally challenged, but also to build capacity, sensitivity, empathy within the society in order for us to treat with this illness, this scourge that has affected and will affect so many of our people. Mr. Speaker, last year, in recognition of that study, and I want to thank Dr. Wright, who is here, who led that charge, we have done the following: increase the cadre of psychiatric nursing aides in the areas where there were none available for employment. So we conducted, Mr. Speaker, 4 months-long training course for 62 students in 2 regions, with a 3rd region to come. So we are training. We have increased the number of community mental health nurses in the Western region by 8. We have acquired motor vehicles, Mr. Speaker, 2 in the first instance, 5 to come, in order to provide coverage on the streets to support those who are mentally challenged. This year we will continue, guided again by that study. We will engage in the education program for the mental health teams in communities, integrate the mental health message in Jamaica Moves, continue with ongoing training of 30 community health aides in the southern region and then the northeast region. We will develop, Mr. Speaker, public-private partnerships with a number of entities out there, NGOs, who currently are, in fact, treating with those who are homeless and who are mentally challenged. And remember, I said a key part of universal access is partnerships. We're going to seek those out, ensure that the standards are maintained, and we will be working with those. Critical, Mr. Speaker, a lot of times in the school system, there are young people who are suffering from depression who oftentimes go unnoticed. And the interpretation of their behavioral challenges is that they are bad or they are deviants, not that they require special help and special care. And we have seen that in the manifesting itself in terms of suicide, manifesting itself in just being wayward in the education system. Mr. Speaker, part of the response is to train teachers, guidance counselors, and physical education coaches in the early detection and referral of mental disorders, particularly depression, build resilience skills and mental health literacy in high school system, Mr. Speaker, and embark on the implementation of an early stimulation program, which has been proven to reduce mental illness, among other significant gains. Mr. Speaker, a major shift based on the recommendation of the report, and indeed globally, is to deinstitutionalize the approach to treating with mental illness. This idea of locking up people, chaining them up, tying them up, is not the way to go to treat those who are mentally challenged. In fact, the solution, as is now being prescribed, is to engage in community participation in restoring those who are so challenged. But part of that, Mr. Speaker, is to break the stigmatization, the stigma that is attached to those who are mentally challenged. This is a major issue, Mr. Speaker, and we intend to deal with it this year. Mr. Speaker, in closing, the public health care, Mr. Speaker, that we all care about and would like to see expand is not just about clinical response to the challenges that we face. As I've said over and over again, part of the challenge that we face in public health, Mr. Speaker, is that we have great doctors and nurses. They may be in short supply in some instances. We deliver good care. We need infrastructure to support their intellectual capacity and the care they deliver. But more often than not, a missing component is delivering care, clinical care, with compassion. Delivering care in a manner that projects the customer service component, the empathy. Mr. Speaker, compassion is therapeutic. It helps in the healing process. And oftentimes when you listen to the complaints within the public health system, if we had delivered care with compassion, patients would be willing to wait a little longer for the care that they so seek. And Mr. Speaker, it's not lost on us, which is why we launched this compassionate care program, which was launched at the Victoria Jubilee Hospital. We will continue to expand this program, Mr. Speaker. We are going into 12 facilities this year, 12 hospitals across Jamaica, improving the facilities, training frontline staff, and preparing our clinical team to recognize and to empathize with patients as we treat with them, and give those patients an opportunity to express themselves by guiding them along the patient charter of rights and responsibilities. Mr. Speaker, the work of the ministry over the past year and our work plan for the short and long term show that we, as a government, are taking responsibility for our obligations to the Jamaican people, their health and the health of the nation. Even in the context of insufficient resources, we are fixing what needs to be repaired and putting in preventative measures to forestall problems that have become apparent. As we do our part, Mr. Speaker, it is also for the Jamaican people to take responsibility for their own health. Many aspects of our health system's challenges are preventable, and they can be addressed before they become costly, difficult problems. Mr. Speaker, healthcare is about two approaches. There's the preventative approach, and there is the curative approach. We spend too much time as a country talking about the curative and ignoring the preventative side. And part of that preventative side is for all of us, including each individual, to take personal responsibility for their own personal health. And that's a message that we must continue to project. Many aspects, Mr. Speaker, of our health system challenges are preventable, as I said, and we must work towards that. The fact that NCDs and trauma are the largest threats to Jamaicans' health and consume the largest proportion of the health budget goes to show that behavior change to prevent those outcomes is an effective and money-saving measure. Not only is prevention less costly, but less damage is done. The government, Mr. Speaker, cannot do that for the people. They have to decide for themselves that their health is worth making changes in their own behavior. For our part, however, Mr. Speaker, this government, we will continue to work towards a modern, safe, and compassionate healthcare provision for all Jamaicans. The truth is, we do have work to do, but we're up to the task. And I believe, Mr. Speaker, under this administration, supported by the Honorable Prime Minister and the Cabinet and my colleagues, I am confident that public health is in good hands as we advance this program for better health. Thank you, Mr. Speaker.
Good one, Chris. Health is in good hands. Health is in good hands.
Mr. Speaker, I ask you to invite the Member of Parliament for Southern St. Catherine to make his contribution to the sectoral debate.
Mr. Jackson.
Mr. Speaker, it is my pleasure to make my contribution in the sectoral debate in this portfolio responsibility for the first time. First of all, let me extend my profound appreciation for the confidence that the Leader of the Opposition has reposed in me to take on this task. Mr. Speaker, I want to thank my family, my blood family, and my Portmore South St. Catherine family. I want to particularly thank my councillors, and I talk about my Portmore constituency family. I must make special mention of my admin assistant, Mildred Diedrich, who is my right hand and my left hand in the constituency for almost 20 years now. Mr. Speaker, this year is a special year. This year, July, would be 24 years in the constituency and my 6th term. And I'm humbled to stand here as the Member of Parliament because of the love and support that I've enjoyed from all the people of my constituency of South St. Catherine. They have always been very dear to me, and I commit to remain very dear to them. Mr. Speaker, the portfolio of national security, as everyone would appreciate, is a very challenging one, regardless of which side of the aisle one may sit. Security is about the well-being of every individual in this country. One's life and their security perhaps parallel one's protection of their property. And so I take it seriously. My colleague from Central Manchester, you will recall in the opening he said he was happy to leave. I think he's happier for him leaving than my coming. But I take pleasure in taking the baton from my colleague from Central Manchester, and I have the benefit of his experience during his tenure. And I also have the benefit of the experience of the Minister of National Security before, the Leader of the Opposition who served in that capacity before. And I also have the benefit of former Minister of National Security, K.D. Knight, who served in that capacity before. Mr. Speaker, I really want to thank the team, my task force members who worked with me in this, and have been working with me in this portfolio. Mr. Speaker, the premise for this contribution is simple, but unfortunately, inarguably true. Make absolutely no mistake, Jamaica's throat is in the grip of a dreadful crime crisis. We live in a nation of less than 3 million people, where in just a few hours, between Tuesday, May 1st, and Wednesday, May 2nd of this year, 7 citizens, including innocent children aged 2 and 11, were slaughtered, massacred, gunned down mainly in their houses or while going about their everyday lives by gun-toting terrorists, seemingly do what they wish, when they wish, and to whom they wish. It is as if the assassins operate with impunity, safe from the forces of the state, while our treasured citizens cower in fear, or in some cases, flee their homes in terror, while schools are closed and people are afraid to go on the streets, even to buy groceries. Mr. Speaker, colleagues, we used to read and view in the media incidents like this taking place in such other territories like Texas, Florida, California, Afghanistan, Iraq. Shake our heads saying, what a shame, or how horrible, or our sympathies, and then turn the newspaper page or change the TV channel and forget it. But now it is happening in our country, in Westmoreland, Jamaica, and is in reality an everyday occurrence in our country, where we live, raise our families, and work. It is happening, Mr. Speaker, to people we know, went to school with, and work alongside, people beside whom we go to stage shows, concerts, church, and eat and drink. Just previous to the Westmoreland 7, there was the St. Elizabeth 4. And since then, Mr. Speaker, triple, double, single murders that read like a menu of insanity in our country. The mainly law-abiding Jamaicans are being targeted randomly by a minority diseased with hate and supplied with weapons of destruction by people who see the murder and mayhem as means to their particular ends and use the naive, easily influenced and bought as their tools to do the violence. Mr. Speaker, I will not insult Jamaicans by echoing other members of this House and pointing out tourists as a special group to be protected. All of Jamaica must be a safe zone for residents and visitors alike. And Mr. Speaker, we as elected lawmakers must make sure that this is so. Mr. Speaker, we must usher out all the criminals and the corrupt. That's our duty. The terrifying high incidence of criminality has ramped up the level of fear in Jamaica to the point where it is the foremost concern of most, if not all, Jamaicans here and in the diaspora. With murders reaching 1,616 at the end of 2017, preceded by 1,349 at the end of 1,616 at the end of 2017 and 1,349 at the end of 2016, now reaching 600 in the first 5 months of 2018, putting us, Mr. Speaker, on the terrifying track for a year in total nearing 2,000. Mr. Speaker, since this government took office in March 2016, we have had 3,384 murders, 3,051 shootings. Combined, Mr. Speaker, 6,435 Jamaicans were either murdered or came close to being murdered. Mr. Speaker, Jamaica is not a safer country since this administration took office. On the contrary, this administration's plain incompetence has allowed Jamaica to become a far less safe country. This is not a mere opinion, but a fact substantiated by the very high increase in murders and shootings since they took office. This fact is even more regrettable given the extent to which the Prime Minister, while in opposition, sought to exploit the concerns over the then levels of murders. And why do I say this? It is the Prime Minister who strongly proclaimed, and I quote, "If Jamaicans want to sleep with their windows and doors open, they should not vote for the PNP. If they want to live safe in their yard, if they want to be able to fall asleep and left their door open and wake up in the morning and still be alive, you cannot make the mistake of putting in the PNP."
Whose words? Whose words?
Those were not my words nor my opinion, Mr. Speaker. Mr. Speaker, Jamaicans believed him. They placed their trust in him. Regrettably, when the Prime Minister got what he wanted, their votes, crime and murder was no longer a priority for this administration. Mr. Speaker, one lesson I've learned very clearly over the years as a representative of the people is never take their trust for granted or abuse it, and never underestimate their intelligence. They are far smarter than we may think. The situation, Mr. Speaker, is compounded by the apparent absence of any clear strategies from the government for intervention in the medium or long term from the very outset upon taking office. Perhaps the strongest pieces of evidence yet that the government is out of its depth in dealing with crime are: one, its inability to present a plan for dealing with crime, and even more basic, its ignorance of what a plan is. Mr. Speaker, let us recall what a plan is. A plan is a document which sets out specific targets, strategies, and activities needed to attain those targets, timelines within which those targets are to be achieved, and the resources that will be deployed to support the implementation of the strategies and activities to achieve the targets. Mr. Speaker will recall the Prime Minister said, the country will not know what the plan is. Those are not my words. Right there. Another grave area of concern has been the absence of functional collaboration between the political directorate and the police. The uncertainty generated by frequent changes in the leadership of the Jamaica Constabulary Force, the recent unparalleled public spat between the previous commissioner, and I say commissioners, and the previous Minister of National Security, the outstanding wage settlements, and the refusal of the Prime Minister to even meet with the Police Federation has compounded our country's distress with the clearly outrageous crime situation. While the issue of the police commissioner seems to be settled now, and we can never tell, but we do wish the new commissioner all the success. As I've said publicly before, his success is Jamaica's success. Mr. Speaker, added to the problems associated with the poor handling of the issue of crime are the public scandals and blatant acts of corruption which have broken the public's confidence in their governors. One such example is the debacle of the dreadfully protracted acquisition of over 200 used motor vehicles for the police force. Mr. Speaker, this scandalous and unprecedented policy of equipping a police force such as ours that is battling increasingly violent criminals has dragged on for over 2 years and has remained unresolved as I speak today, Mr. Speaker. A contract we entered into from January 2017, only 36 of the 200. We see the government offering, Mr. Speaker, we see the government offering crime fighters unreliable second-hand cars, then turning around and purchasing over $190 million of new vehicles for ministers upon coming to office. And compounding that felony, Mr. Speaker, by spending over $40 million for high-end motor vehicles for the Prime Minister. Mr. Speaker, this used car policy for police was flawed from the outset and had all the markings of corrupt intentions. The payment of 50%, deposit on a transaction to a company which does not have a stellar record in that particular area, as confirmed the report from the Office of the Contractor General. The repeated extensions and the failure of delivering those 200 cars, for which only 36 have been delivered so far. The opportunity cost in hundreds of Jamaican lives, the delay in providing the police with required mobility are all part of the consequence, Mr. Speaker, of this corrupt policy of the government. Mr. Speaker, we will never know how many crimes would have been prevented, how many murders could have been stopped, how many criminals intercepted, how many fearful citizens might have received a reassurance by the police turning up at their premises in response to a call, and how much confidence in the police that might have been restored if these cars were available. This is the real price of this government's blatant and rampant corruption that the Prime Minister presides over. Mr. Speaker, bad policies can have costly consequences, but poorly implemented policies can cost lives and damage the reputation of law enforcement officers. Mr. Speaker, all segments of our Jamaican society are outraged and scared. The almost constant call by many Jamaicans for a unified effort between the government and the opposition to deal with crime is an explicit acknowledgement that this government by itself is not capable of dealing with the crisis. It is also an explicit confirmation by the public at large that this government by itself has been a proven failure. Mr. Speaker, the public has also indicated that the input of the opposition can and will make a positive difference. We on this side, Mr. Speaker, have always been willing to do so, while acknowledging that the present situation was created by the government's abject failure to handle the problem of crime in Jamaica over the recent years. Mr. Speaker, many persons have asked, where is the opposition's crime plan? But, Mr. Speaker, the responsibility for a crime plan in Jamaica now and during this government's tenure, whatever length that may be, falls to the elected government of the day. The opposition is not the government and has no executive authority to implement anything. In this democracy that we operate, Mr. Speaker, we have only one elected government at a time. Mr. Speaker, I will assure you and the country that we, while in opposition, have started to put together a crime plan, knowing quite well that a complete plan requires critical information and data that is in fact exclusive to the state apparatus and not fully accessible by the opposition. I also assure you that we will be ready to fine-tune a crime plan upon taking office when that time comes. We stand ready, Mr. Speaker, to support any viable and far-reaching crime plan that the government, with our cooperation, may present. Jamaica's interest is our business, it's our passion, and it's our mission. From the Mr. Speaker, from the public feedback, I believe Jamaicans at large, I feel Jamaicans at large feel criminals are in control and are easily able to do what they want when they want. Jamaicans have no confidence of any firm and resolute resolve to take back control of the streets and demonstrate to criminals, present and aspiring ones, that they will have a strong political directorate to contend with between themselves and the peace-loving citizens of this country. Mr. Speaker, let us look at some data, not opinions. Between 2007 and 2011, when the JLP formed the government, 7,408 murders were recorded, resulted in an average of 1,482, with a high of 1,680 in 2009 and a low of 1,125 in 2011. Between 2012 and 2015, the PNP's full 4 years in office, the total number of murders recorded was 4,494, for an average of 1,124, with the lowest being 1,005 in 2014. Between 2016 and calendar year 2017, the total number of murders recorded was 2,966. That's for the calendar year. 1,350 in 2016, and as I indicated earlier on, 1,616 in 2017, for an average of 1,483, which is 23% higher than the most recent worst year under the People's National Party administration. These figures, Mr. Speaker, they don't lie. And what is instructive or coincidental is that the average of 1,482 between 2007 and 2011 is the same +1 between 2016 and 2017. This record high average of 1,482 is 32% higher than the average recorded under the People's National Party administration. The Prime Minister, no, you can check the police stats. The Prime Minister, unfortunately, repeated this misrepresentation in his recent contribution in the debate on the extension for the state of emergency in St. James. Mr. Speaker, you know, it is not only in relation to the crime stats that this administration has been purveying false information. They have done it in relation to the growth in the economy. As the member from South St. Andrew pointed out in the budget debate recently, contrary to the false narrative of the government, economic growth under the People's National Party administration between the years 2005 and 2006 and the present, during which time the PNPL office for 6 full years was cumulatively 6%. Over the same period when the JLP was in office for 5 full years, the cumulative growth during their time was 1%. Those are the facts, Mr. Speaker, not opinions. Mr. Speaker, in 1962 at independence, Jamaica had a murder rate of 4 in 100,000. And these are the stats that are used internationally to measure murder rates globally. It was 4 in 100,000. Today, it is 60 in 100,000, an increase of 1,500%. A rate of 30 per 100,000, Mr. Speaker, is the global benchmark for what is described as civil war. Jamaica's murder rate is higher than in zones of intense conflict. The rate in parishes like Clarendon, Westmoreland, St. Catherine, and St. James are above 100,000. Above 100 per 100,000. Mr. Speaker, we cannot accept these abnormally high murder rates to be a norm in this country. Mr. Speaker, I'd like to use some of my time to address some of the short, medium, and long-term solutions for improving national security, restoring faith in law enforcement, strengthening partnerships, integrating key areas, and reducing murders and other crimes. There's a need for a unified effort between the government and all sectors of the society in tackling crime, and not just with the opposition. The people of Jamaica are calling on us and looking to us for this unified effort between the government and the opposition to deal with crime. I must emphasize, Mr. Speaker,